So today I'm going to be doing an assessment on my patient, Melinda. I have gathered all my appropriate equipment that I need, my stethoscope, and then I also will be needing my pen light for certain parts of the assessment. I've provided privacy. I'm going to be performing my hand hygiene, and I've explained to her the steps that I'm going to be taking just to let her know of what's going on and when she'll be needing to breathe and speak and things like that during the assessment. So the first thing I'm going to do is just look at her general appearance, make sure she doesn't have any body deformities, things like that. If she were standing up for the assessment, usually for the assessments you would want them sitting down or laying in bed, but if they were standing up you could assess their mobility, look at their gait, make sure they don't have any tremors or involuntary movements, things like that. Then you would want to assess their personal hygiene. She's neat, her clothing's appropriate, she doesn't have any body odor, she's not disheveled, things like that. She has good posture, and she's in a good position. So then throughout the assessment you also want to be looking at her skin as well, noting the color, if she has any lesions or scars, breakdown, things like that. Just throughout the entire assessment, just looking at her skin, but for video purpose, we'll say now we would assess her skin, such as her hands. So I'd make sure her skin color is appropriate. She doesn't have any jaundice or cyanosis. Her nail beds are clean. She doesn't have any clubbing of the fingers or indentations in her nails. And if you wanted to, you could also check her cap refill, but that's more for circulation. So after you've looked at her skin, you could also want to check her mood, her affect, her level of consciousness. She's awake, she's alert, her speech is appropriate, can she hear your normal voice tone, things like that. She can maintain good eye contact with you. So then after you did all of that, you could go ahead and inspect the head and the face. So she has facial symmetry. Usually when you test facial symmetry, you could ask them to smile really big or puff out their cheeks. And her face is symmetrical. I'm going to palpate her scalp and just note any bumps or deformities that I feel on her scalp area. Her hair isn't super thin or coarse, and the color is appropriate. Then I would also want to move down to her temporal artery and palpate that. And the pulses are symmetrical, bilaterally equal. And then you move down to her temporomandibular joint in her jaw and palpate, make sure there's not any inflammation. Go ahead and open your jaw and close it. And make sure there's no tenderness in the joint and her jaw can open evenly. And then after you palpate her jawline and her jaw, you'd move on to her frontal sinuses. So go ahead and palpate the front of her forehead here and make sure she doesn't have any inflamed sinuses, there's no lumps, and her sinuses are all good. So after you've done the head and the scalp, we're going to go ahead and move on to the eyes, and you would start off with the vision tests. So for the vision tests, a good one to start off with would be the confrontation test, which is testing their peripheral vision. You would ask them to, well, as the administrator, you'd want to stand in front of the patient and ask them to cover up one eye. Let's go ahead and cover up an eye. And then you would stand in front of them and ask them when they see your finger come into their peripheral vision. And that just tests their peripheral vision. Another test you could do would be the corneal light reflex, which you need your pen light for. And you want to hold the light about 30 centimeters away and have them look straight ahead and look at the reflectiveness off the cornea. and you want it to be equal and in the same spots on both sides of the eye. After that, you could do the 6 cardinal directions, and that just tests their eyesight. So yeah, go ahead and sit in front. And then ask them to look straight ahead, and you would go out, up, and down, back across, down, and back to the midline. And when you do the 6 cardinal directions, you want to make sure they keep their head and neck straight and that only their eyes are moving. And you want to make sure and look for any twitching of the eyes, any nystagmus whenever they look. That would be abnormal. After that, you could do the cover test, which tests for any deviated alignment. You would have them cover one of their eyes. Well, first you'd have them look straight at your nose. You'd want to be eye level with them. You'd have them look straight at your nose, and you would cover up one of their eyes. And you would look in their other eye to make sure it doesn't deviate or look away. It should stay straight looking at your nose. So go ahead and look straight here at my nose. Okay. And you would want to watch in this other eye that's not covered up to make sure that it doesn't deviate. It should stay straight ahead. So after you've done the vision test, then you can actually go ahead and assess the eyes themselves. So you'd want to inspect the external structures, make sure that there's no eyelid drooping. You would want to look at their conjunctiva and the sclera. You could have them look up. That's good. There's no yellowing of the eyes. There's no excessive watering. There's no redness to the eyes. Her irises are round. There's no irregularities in the irises. And then you'd want to check her pupils and make sure that they're not dilated or pinpoints, and then you'd want to make sure that they are reactive to light. So you use your pin light, look straight ahead, and make sure that they constrict and dilate appropriately. So whenever this one dilates or constricts, if this one constricts with the light, so should this one, and that would be accommodation. So her pupils are equal and reactive to light, and they are accommodating to one another. So after that, you could do a Snellen test. If you were to do a Snellen test on your patient, you'd have them stand about 20 feet from a Snellen chart, have them cover up one eye, and have them read down the Snellen chart as the letters get smaller until they can't read the smallest line anymore. And that would be how you test